Welcome back to Insurance Therapy with Sasha, where we break down Medicare, health insurance, medical bills, prescription costs, and all the confusing fine print without the headache. Today, we're tackling a question millions of people face. What can you do when your prescription costs more than you can comfortably afford? Stay with me, because I'm sharing 10 practical ways to potentially lower medication costs before you ever consider skipping a dose. What would you do if the medication keeping you healthy suddenly became too expensive to afford? Have you ever gone to pick up a prescription, heard the price $275, and felt your stomach drop because you honestly didn't know how you were going to pay for it? Maybe you found yourself wondering whether to fill a prescription or cover groceries, rent, utilities, and other essential bills. If that sounds familiar, you're far from alone. High prescription costs aren't just frustrating. They can create immediate stress, threaten your access to treatment, and force impossible decisions that no one should have to make. And when medication becomes unaffordable, waiting too long to explore your options can put both your health and your finances at greater risk. That's why it's so important to act quickly and learn what resources may be available before you ever consider going without the medication your doctor prescribed. And before we go any further, never stop, skip, or change a medication without talking to your doctor or pharmacist first. Medical advice should come from healthcare professionals, not social media, internet searches, or your cousin at the family cookout. Let me introduce you to Miss Linda. She's 67, has Medicare, and takes medications for diabetes, blood pressure, and cholesterol. She does everything right. She visits her doctor, gets her prescriptions, heads to the pharmacy, and waits her turn. Then she hears, "Your total today is $412. Miss Linda's first thought, "For what? The entire pharmacy?" She wasn't expecting that bill. Now she's standing there stressed and embarrassed, trying to figure out how medication fits into a budget already stretched by housing, food, transportation, and everyday expenses. That's where many people get stuck. Some leave the prescription behind. Some stretch their medication. Some decide they'll wait until next month. But unfortunately, your health doesn't always wait for your budget to catch up. What's even more frustrating is that there may have been ways to reduce the cost if someone had explained the options. So what should you do when a medication feels unaffordable? 1. Make sure your insurance was billed correctly. Ask the pharmacy whether the prescription was processed through the correct insurance plan. Incorrect information, deductible issues, prior authorization requirements, or network problems can affect the price. 2. Ask about a generic version. Generic medications often cost less than brand name drugs while meeting FDA standards. Ask your doctor or pharmacist whether a generic option is appropriate for you. 3. Ask your doctor about lower cost alternatives. Sometimes another medication in the same category may work just as well and be covered more favorably by your insurance plan. 4. Review your plan's formulary. A formulary is the list of medications your plan covers. Drug tiers, coverage rules, prior authorization requirements, and quantity limits can all affect what you pay. And baby, some tiers are much friendlier than others. 5. Ask about a formulary or tier exception. If a medication isn't covered or carries a high cost, your doctor may be able to request an exception based on medical necessity. Approval isn't guaranteed, but it's worth exploring. 6. Check whether you qualify for Medicare Extra Help. This program may help eligible individuals with prescription drug premiums, deductibles, and copays. Don't assume you won't qualify. Ask questions and check your eligibility. 7. Compare pharmacies. Prices can vary depending on your plan's network. Preferred pharmacies and mail order options may offer lower costs for the same medication. 8. Explore assistance and discount programs. Many manufacturers offer patient assistance programs that may provide free or reduced cost medications for eligible individuals. If you take a brand name medication, search the drug name along with Patient Assistance Program. Also, ask your pharmacist about discount cards or savings programs. In some cases, the cash price through a discount program may be lower than your insurance copay. 9. Review your drug coverage every year. Medicare Part D and Medicare Advantage drug plans can change annually. Drug tiers, pharmacy networks, premiums, and deductibles may all be different from one year to the next. A plan that worked well last year may not be your best option this year. 10. Keep your paperwork. Save receipts, explanation of benefit statements, approval letters, denial notices, and medication lists. Good records can make it easier to resolve problems or apply for assistance. Now let's go back to Miss Linda. Instead of walking away, she starts asking questions. She confirms her insurance information. She checks whether prior authorization is needed. She talks with her doctor about alternatives. She compares pharmacy prices. She asks about extra help. She reviews her coverage during open enrollment. Will every prescription suddenly become inexpensive? No. But asking the right questions can uncover options, and options matter when every dollar counts. Today's takeaway is simple. Don't suffer in silence at the pharmacy counter. Don't assume the first price is the only price. Don't skip doses without medical guidance. Don't wait until you're completely out of medication to seek help. Instead, ask the pharmacist. Talk to your doctor. Call your insurance company. Review your formulary. Ask about generics, exceptions, assistance programs, and mail order options. The sooner you ask, the more opportunities you may have to save. Because, baby, your health matters, your money matters, and your peace of mind matters too. If this episode helped you better understand Medicare prescription coverage, medication costs, or prescription savings programs, subscribe so you don't miss future episodes. And share this with someone who may be struggling with high medication costs. This content is for educational purposes only. Always consult your doctor, pharmacist, insurance company, Medicare, or another qualified professional before making decisions about medications or coverage. Watch the full conversation on insurance therapy with Sasha. And remember, expensive medication can make you feel stuck, but the right questions can open doors. Don't let a pharmacy price tag scare you into silence. Ask before you walk away.